All righty, buckle up. This is a big pile of stuff to go over today on the Town Meeting program, Friday, April 24th, here on KLAM. And we are pleased, as always, to be brought to you on this show by Cordova Wireless Communications, your local cell phone provider, which provides your local cell phone service and keeps those cell phone dollars in town to circulate through our economy, which is in many ways more important now than ever. And we sure appreciate their support for many of the things that we do on the radio. And I thought that kind of our top item for today's show was going to be the gradual reopening of certain businesses that were in the non-essential category. Had this wonderful agenda lined out for that. And then came Health Mandate 17, having to do with commercial fishing. So we're going to go over that first, since that's our most important topic in general, of course. And again, if you want to be able to look at this and study it more in depth, and particularly be able to read the appendices that go with this new health mandate, you can see it on the state website, covid19.alaska.gov. I didn't check to see if it's on our local city website yet. It may be. And, of course, the city is, I'm sure, going to have a very busy day exploring this new state mandate and seeing how well it interfaces with things that the city is doing. I can't speak to that at all, so we're not going to try to do that. All I'm going to do is go over what it says in the new state mandate, and then we'll see. I don't know if they'll have an idea in time for the broadcast that they do over YouTube at 4 p.m. this afternoon. I don't know if they'll have enough of that integrating done, but I'm sure they'll let us know. And actually, I'll ask Clay about it, probably Mayor Copeland, when we do the daily briefing later on. So two kind of big deal things today, the commercial fishing update from the state and also the gradual limited reopening of some businesses, which is another pretty significant step in the evolution of the pandemic. So let's start. So anyway, if you want to read this, it's easily findable on the state site, covid19.alaska.gov. So here's how it reads. To slow the spread of COVID-19, the state of Alaska is issuing its 17th health mandate. And I'm skipping over some of the gobbledygook here. Mandate 17 goes into effect April 24th, today, at 8 a.m. and will be reevaluated on May 20th. The mandate is issued to protect the public health of Alaskans. By issuing this mandate, the governor is establishing consistent mandates across the state in order to mitigate the impact of COVID-19. The goal is to flatten the curve and disrupt the spread of the virus. The purpose of this mandate is to enact protective measures for independent commercial fishing vessels operating within Alaskan waters and ports in order to prevent, slow, and otherwise disrupt the spread of the virus that causes COVID-19. The state of Alaska acknowledges the importance of our commercial fishing fleet to our economy and lifestyle as Alaskans. In order to ensure a safe, productive fishing season this year, while still protecting Alaskan communities to the maximum extent possible from the spread of the virus, the state is establishing standardized protective measures to be followed by all independent commercial fishing vessels operating in Alaska waters and ports. So that's sort of the preamble. Now, the actual Health Mandate 17, Protective Measures for Independent Commercial Fishing Vessels. The first section is applicability, and they start with the definition. It says, for the purposes of this mandate, independent commercial fishing vessels are defined as all catcher and tender vessels that have not agreed to operate under a fleet-wide plan submitted by a company association, or entity that represents a fleet of vessels. This mandate alleviates the requirement for independent commercial fishing vessels to submit a community workforce protective plan in response to health mandates 10 or 12. 10 and 12, remember, were the two travel mandates for out-of-state and in-state travel. And we should probably add at this point that as far as we know, this new state mandate and that thing that it just said, alleviating the requirement for submitting the community workforce and protective plans, that does not exempt anybody from still needing to file that city mutual aid agreement. So more than likely, and this could change, but more than likely, independent commercial fishing vessels should expect to fill out state and local paperwork. And we'll see if we can get some more clarification, but that's how it would appear at this point. Also under applicability, this mandate does not apply to skiffs operating from shore. Protective measures for those vessels will be provided under separate guidance. Now, the next section of the mandate is required protective measures and plans. Independent commercial fishing vessels operating in Alaskan waters and ports must enact the protective measures and procedures described in Appendix 1, the Alaska Protective Plan for Commercial Fishing Vessels. And there is a link to that appendix. It's way too long for us to cover here. We mainly want to let you know that it's there, and the state expects you to read it and implement all of these measures. So Appendix 1 is a big old list of mitigation, and it's expected that the vessels will enact those things and attest to the fact that they're going to do that. This part also says vessel captains must enact controls on their vessel to ensure crew member compliance with this mandate. Next section of Health Mandate 17 is travel and access. It says compliance with this mandate does not constitute a right to travel or access into any areas. And then it is incumbent on the individual traveler to ensure that any proposed travel itinerary is still possible and adhere to any additional restrictions enacted by air carriers and lodging facilities or by small communities in accordance with the State of Alaska Small Community Emergency Travel Order. That's Health Mandate 12 Attachment B, which doesn't really apply to us, but there it is. Now, here's the beef. If you're asking, where's the beef? Here's the beef. Compliance and penalties. Vessel captains are required to maintain documentation as directed by Appendix 1, Paragraph 1. I looked at that, by the way, and that is logging. So vessel captains are required to maintain that documentation and must provide a copy of the Mandate 17 Acknowledgement Form, which is Appendix 2 for Health Mandate 17, and I have one of those, and we'll go over what it says. It's not multiple pages long like Appendix 1. So you have to provide a copy of that acknowledgement form upon request by any seafood purchasing agent or federal, state, or local authority to include law enforcement and fisheries regulators. So you have to have this form filled out and ready to show on request. A violation of a state COVID-19 mandate may subject a business or organization to an order to cease operations and or a civil fine of up to $1,000 per violation. In addition to the potential civil fines noted above, a person or organization that fails to follow the state COVID-19 mandates designed to protect the public health from this dangerous virus and its impacts may, under certain circumstances, also be criminally prosecuted for reckless endangerment pursuant to Alaska statute. Reckless endangerment is defined as follows. A person commits a crime of reckless endangerment if the person recklessly engages in conduct which creates a substantial risk of serious physical injury to another person. And then it notes that this is a Class A misdemeanor. Pursuant to Alaska statute, a defendant convicted of a Class A misdemeanor may be sentenced to a definite term of imprisonment of not more than 1 year. Doesn't sound fun. Additionally, under Alaska statute, a person may be fined up to $25,000 for a Class A misdemeanor, and a business organization may be sentenced to pay a fine not exceeding the greatest of $2.5 million for a misdemeanor offense that results in death, or $500,000 for a Class A misdemeanor offense that does not result in death. So, I admit I'm not a lawyer, but on the surface, it sounds like they're not messing around, and they want these, what are defined as independent commercial fishing vessels, to read this stuff and fill out their form. Now, again, it's the forms, this news release, well, it's not really a news release, this health mandate and the two appendices are real easy to take a look at if you have a smartphone, computer, tablet, whatever. So you'll definitely want to read through Appendix 1. And then Appendix 2 is a form that acknowledges that you understand and are going to abide by all of this. And I'll read through this for you just so people have an idea. This is the State of Alaska Department of Health and Social Services Independent Fishing Vessel Protective Measures Acknowledgement Form, Mandate 17, Appendix 2. And it reads, the State of Alaska acknowledges the importance of our commercial fishing fleets to our economy and lifestyle as Alaskans. In order to ensure a safe and productive fishing season this year, while protecting Alaskan communities to the maximum extent possible from the spread of the virus, protective measures are necessary for independent commercial fishing vessels operating within Alaskan waters and ports in order to prevent, slow, and otherwise disrupt the spread of the virus. Now, what they ask you to fill in on this is vessel name and USCG number, your Alaska home port, name of the captain, number of crew total, number of crew that are immediate family members, and number of crew that are non-family members. And then what you're expected to certify in filling this out is you say that you've read and understood all of the requirements of Mandate 17. As captain of the above-named vessel, I hereby acknowledge and agree to comply with the protective plan outlined in Appendix 1 of Mandate 17 for the 2020 fishing season. I agree to comply with all other mandates and health advisories issued by the State of Alaska and any local community mandates, ordinances, or directives that are not in direct conflict with this mandate. I agree to keep a copy of this form and any other documentation required under Mandate 17 and Appendix 1 for the entirety of the 2020 fishing season. I shall produce this form and any other required documentation upon request to the United States Coast Guard, the State of Alaska, Department of Fish and Game, Department of Health and Social Services, and/or local, state, and federal authorities. I swear or affirm under the penalty of perjury that the above information I provided on this document is true and correct. I swear or affirm I will comply with all of the requirements set out in Appendix 1 of Health Mandate 17. Then it has a warning. If you provide false information on this form, you may be convicted of a Class B felony and a Class A misdemeanor, punishable by imprisonment of not more than 10 years, and by a fine of up to $100,000 for an individual or up to $2.5 million for an organization. Additionally, due to the imminent danger to the public by the spread of the virus, if you violate the self-quarantine recommendations set forth in the mandate, you may also be convicted of a Class A misdemeanor, punishable by a fine of up to $25,000 or imprisonment of not more than 1 year. Then they ask for a signature, a date, and the printed name. So they're not screwing around. And again, these documents, the mandate, the appendix with all of the details that these fishermen are expected to know, and the document that I'm holding now that where you sign and fill out the information. It's all serious stuff. And you can get it all very easily from the state website. And, I know people will have differing philosophical views on whether this is appropriate or not. And maybe there will be some who will say, I'm not doing what the government says, and that is what it is. If it was me, I think with potentially millions in fines and jail time for potential perjury or violating mandates or all of that, it seems like it'd be a good idea to download it and read it. So again, this is Health Mandate 17 you want to look at from covid19.alaska.gov. And we certainly wish everybody the best in making that work. Okay, now moving on to what I thought was going to be the sort of top story of the day, which is the first phase of what the administration is calling Reopen Alaska Responsibly. And if you want to read what I'm sharing with you here, then again, go to covid19.alaska.gov, and there's a button there. It's yellow, I think, that invites you to take a look through this information. Cover page says, on April 22nd, Governor Dunleavy announced Health Mandate 16, which outlines Phase 1 of his Reopen Alaska Responsibly plan. Phase 1 seeks to balance the ongoing need to maintain diligent efforts to slow and disrupt the rate of infection with the corresponding critical need to resume economic activity in a reasonable and safe manner. Now, something that's probably worth addressing editorially, I guess, here, is there's been, how does one put it, some extreme views on two different sides of what this reopening thing means. On the one hand, you've got the folks who are like, who have been very aggressively reopen the economy and are happy about this and sort of touting it as, look, we're going back to normal. Everything's reopening. This is just like it was before the pandemic, which is hideously inaccurately wrong. This gradual reopening phase is nothing like business as usual. And we'll cover a little bit of why. On the other side of that coin are the people that are saying, oh, dear Lord, they're reopening the economy, putting profit over life, and they don't care about vulnerable people and all this sort of stuff, which is also not accurate. Because, again, this is not a business-as-usual type situation. It's actually, if you wanted to sort of summarize it, it's a 25% of, it's like a one-quarter return to business. As, again, I think will become clear. This thing is not an excuse to just open the floodgates and say, hey, everybody just go back to the way it was. Nor is it an excuse to start leaving home, which again, for those folks that think that this is the business community trying to harm or just not care about vulnerable people, just because some of these businesses are returning to a limited level of reopening doesn't mean that anyone is saying, start leaving your homes, don't worry about social distancing, any of that. Quite the opposite. They've gone to lengths to say the limited reopening is not an excuse to flood the streets. There's been a continued emphasis on the importance of staying home unless absolutely necessary. If you have to be out, be absolutely sure you're social distancing. In Cordova specifically, if you have to be out, you need to have your mask on, except for those few exemptions for masks. And if you're going to go to one of these businesses that is now allowed to reopen, if it chooses, and that's an important point too, but if you're going to go to one of these businesses that has been shut down up to now and is now allowed to reopen on a limited basis, you need to follow all of those rules. So, again, nobody should perceive that it's just a haphazard, open the tap wide open kind of thing. And also, that point that I mentioned, the state is saying that these different types of businesses, again, which we'll go over, are allowed to open in limited capacity with very specific sets of rules. The city is not allowed to counter the state mandates on this. Some people may, have an inclination to, if you're somebody that doesn't want to see any businesses opening and the state is saying it's okay on this limited basis and you don't like that, there may be an inclination to go to the city and say, hey, mayor, city council, do something more restrictive so it's different in Cordova. The city can't do that. There is very specific language in Mandate 16 that says that they can't. So if you have any kind of a complaint about the reopening pace, you'll need to run that up the chain to the state. The city can't countermand what the state does. What made that kind of confusing is that Mayor Berkowitz in Anchorage did manage to negotiate an exemption into the mandate for Anchorage. They're going to wait until Monday, but Anchorage is the only city, because they've got more cases of it, more potential for spread. It makes a degree of sense. Personally, I get tired of Anchorage very often seeking to treat itself differently than the rest of the state, but whatever, But the point is, Anchorage was the only city written into the mandate as being able to delay. All the other cities have to follow the state's guidance on this. However, again, an individual restaurant or business that is allowed to reopen under this mandate, they don't have to choose to. If we have a restaurant in town that believes, for whatever reason, that staying closed and not allowing dine-in at all, the state can't force a restaurant or salon to allow people through their doors. So each business owner will be able to choose on their own. And I've already seen some businesses that say, I don't care what the governor says, we're still going to only do takeout, or we're still only going to work through a window, or something like that. So, respect to those that follow their conscience or sense of propriety or whatever in either direction. To open on a limited basis under these restrictions, or maybe to not open because they either think it's a bad idea or they don't want to operate under these restrictions and decide that it would just be easier to stay closed. What one of these businesses should not do is assume that because certain businesses are allowed to reopen that they can just go back to business as usual. That's a mistake that a business owner needs to not make either. Because again, in each of these categories, there is a document that says what the rules are and how you will operate. And if you don't operate in accordance with those rules, there are some pretty stiff penalties. I don't remember what they are, but they're big numbers, kind of like what we just covered in the fishing document earlier. So if, for example, a restaurant, let's start with restaurants since they're first on this list. According to Mandate 16, restaurants are allowed to begin limited opening today by reservation only. They are also restricted to 25% of their seating capacity. They're also not to allow groups of people to sit at the same table that are not from the same household. So mom, dad, and the kids that all live together can make a reservation and go to a restaurant and sit together. But if you want to have, a luncheon with some of your, coworkers you haven't seen in a while or something like that, and you're not in the same household, you're not supposed to sit together. And if the restaurant allows you to do that, the restaurant's going to get in trouble. If you go in and fib to the restaurant about that, then you could get the restaurant in trouble, or you could end up getting in trouble for violating the health mandate. Because individuals, remember, are responsible. That would constitute reckless endangerment. If you've got friends in different households, different apartments, whatever, and you say, the restaurants are open a little bit, let's all get together and go in and we'll just all say we live in the same apartment or something like that, and it's found out that you're being false, that's reckless endangerment, which could cost you $25,000, all of you, and maybe up to a year in jail. So restaurants are reservation only, no more than 25% of their capacity. The only groups that can sit together are people in the same household, and there has to be at least 10 feet of separation between between parties from different households. So, for example, if family A comes in, they're all the same household, they get seated, and family B comes in, family B can't be seated closer to 10 than 10 feet. They have to be at least at a table at least 10 feet away from the first family. And that goes for individuals. If you're a party of one, there has to be 10 feet of separation. So you see, this is not business as usual, not by any stretch. It's still very contained. It's just sort of a baby step. I mean, that's in my opinion, sort of a baby step in the direction of starting things up a little bit. Also, under restaurants, the staff has to have face coverings. It's a universal face covering rule, and also sanitation and cleaning protocols. So that's under the heading of restaurants, and there is a guidance document under each of these categories that shows the restaurant owners what they have to do in order to have dine-in, if they choose to. And also it'd be good for potential customers to read this too, so that you know what to expect if you're going to go to a restaurant that's going to open in this limited capacity. And also, so you as a responsible customer of that restaurant are not asking them to do anything that's going to get them in trouble or get you in trouble. If everybody knows the ground rules going in, this thing works. If people blow it, or they don't care, or they ignore, or they don't read, or they assume, any of these potential weak links in the chain, then the whole thing collapses and everything gets closed again. So each one of these different categories, and this is all again under the Reopen Alaska Responsibly Phase 1, which you can read, not just the summaries, but the actual guidance documents. This is all at covid19.alaska.gov. Retail operations that were considered non-essential and had to shut down can do limited opening starting today. The summary is they have to stay at 25% capacity. They have to have universal face coverings on all their employees. And in Cordova, customers also have to have face coverings. And then they also have to have enhanced sanitation and cleaning. Personal services, this is like hair salon, nail salon, tattoo parlor, that kind of thing. They are allowed to do limited openings starting today. Their rules are a 1-to-1 staff-to-customer ratio. Now, you'll want to read the document to be sure about this, but as I understood it when this was being discussed before, basically a hair salon could serve one customer with one staff member at a time, and that's it. More than likely, that would mean doing business by appointment. I don't see that in the summary, but again, it's in the guidance document. So there again, that's why these documents are good to read. If you're a salon or that kind of business, the ones that qualify under personal services, and that's not just hair cutting and nails, but there may be other things in there too. But businesses that qualify under personal services, 1-to-1 staff to customer ratio, so they can only serve one person at a time, universal face coverings, sanitation and cleaning, and no waiting rooms. So, if you're next, whether you have an appointment or however they do it, whoever is next can't be in the building. You can only have one customer in one of these places at a time. The next sections are non-public facing businesses and public facing businesses. I will confess I don't even know what those are. So those of you that do can look at the guidance documents, but the summary, again, is mandatory social distancing, mandatory universal face coverings, mandatory sanitization and cleaning. Fishing charters can start today with social distancing, capacity restrictions, which are laid out in the guidance document with examples. And fishing charters have to have cleaning and disinfecting protocols. Gyms, as in gymnasiums, limited operations can start today with mandatory social distancing, mandatory outdoors only. That's kind of an interesting one. They still don't want people inside the gyms, but if whether it was a Gold's Gym or a Planet Fitness and I don't know if Bedarky has any programs like this, but if they want to do something that is outside, they can do that with up to 20 people as long as there's social distancing. So if you were taking an outdoor aerobics class and the instructor said, "Oh, we're outside, we don't need to be 6 feet apart, everybody get together and let's bond and kumbaya." No, that person, anybody that suggests that, is in serious trouble, as would be anybody who attended one of these things and was starting to get close to people. Reckless endangerment, remember. So gymnasiums, the health fitness centers, that kind of thing, can have outdoor activities limited to 20 people, mandatory social distancing, and also sanitation and cleaning as appropriate. That also goes for child care and day camps. Limited operations starting today. Social distancing is mandatory. Outdoors only is mandatory. Universal face coverings, sanitation and cleaning. And then there's some other provisions for intrastate travel and activities and remote lodges and camping. And you can read all of this, the summaries and the detailed documents. And again, I would really urge people to look at the detailed documents so everybody knows what's at stake and what's expected. And while these documents are primarily made for the different types of business owner, if you care about the business you want to patronize, it would be really good to look at these documents as a customer, not only so you don't accidentally get them in trouble, and also so maybe you can help if that business is accidentally doing something that it's not supposed to. Say a business owner didn't thoroughly read the guidance and is open and is allowing things to happen that shouldn't be. If you have read the document for that restaurant or that health and fitness business or whatever, you'd be in a position to, be like, "Hey, did you know such and such?" And they could either say, "Oh, geez, no. Okay, thank you for telling me." Or they might say, "Yeah, I know and I don't care," in which case I'd leave. Okay, well, if you don't care. Now, of course, along with all of this stuff with the rules and, people helping each other to stay on the same page, we should probably address vigilantism, which I'm sad to hear is continuing to be a thing. We have some folks who are taking their efforts to encourage compliance to the kind of ragey level, which is really a shame. Again, in an isolated community where everybody knows everybody and everybody has to live together, for some people to be raging on folks regarding masks, and it's one thing to point it out in a community spirit, but it's another thing to yell at people like I've been hearing people have been doing, or harassing or threatening, flipping the bird. None of that is going to give us a better sense of community. Helping each other out, absolutely. Pointing things out, you bet. But crossing the line, and I only mention this because council had to talk about it. They've been getting reports from people who have been treated so badly by other people in the community that they're afraid to even do anything, even things that they're allowed to do and that they're doing right. They don't want to. People are being scared into their caves, and that's not only tragic, it's immoral. So I really hope that people will avoid that tactic. And frankly, while violating a number of these provisions and these mandates is punishable and is reckless endangerment, so is harassment. And if you're harassing people and you get punished for it, you made your own bed, I guess. So civility would really be the best way to go here. And I hope, and I'm sure that the majority of people are doing that. It's just a few outliers, but the amount of damage that they cause proportional to the number of them that there are is, it's just unfortunate. And of course, it's one thing if you try to help somebody understand what the rules are and they say, hey, get out of my face. I don't have to follow the rules. Well, if somebody's going to be a butthead and just flat out belligerent about it, then you turn them in. I wouldn't yell back if I were you and get into be like an umpire and a baseball manager. But if somebody is deliberately and recklessly flaunting the rules, then that's what reporting to the authorities is about. But still, vigilantism is just nah. And actually, this would be a good time. I've still got some other stuff to go over, but since we're on this subject, I saw a great piece written by somebody in the medical profession that circulated yesterday or the day before. I can't quite remember, but I just want to read this because this was one of the most encouraging things I think I've seen a person write about this whole situation since I can remember. So again, this is somebody in the healthcare industry, I think, and they say, I'm going to try again to throw this out. I've typed it about 12 times and then stopped because it's so touchy. I'm seeing so much anxiety about resuming business and so much anger about continued regulations. People are feeling the need to catapult to one side or the other, then fight the opposition. Here's my perspective from a mainstream medical model. I think a lot of folks have fallen into the idea that social distancing was meant to stop the viral spread. It wasn't. It was meant to slow it while we put medical infrastructure in place. It's worked. We have. In most parts of Georgia, this person's from Georgia, we have, in most parts of Georgia, not been overwhelmed like we likely would have been without better protective measures. In the meantime, our testing procedures have gotten better. We've increased our ventilator count. We've gotten a little better handle on PPE supply chains, and many have helped by making masks and gowns. It's not perfect, but it's much better than it was 7 weeks ago. A vaccine is a long way off. At some point, people have to be systematically exposed to begin the building of, hopefully, herd immunity. We will likely begin to experience a real increase in cases after reopening. Ideally, that exposure is controlled and calculated in phases to allow our medical community to respond adequately and reduce the number of severe or fatal cases. That's where we are. Whether you feel like people are opening things too soon or not soon enough, we were never going to social distance this thing into non-existence. You now need to proceed as your health, your wallet, and your conscience allow. If you are medically vulnerable, you do not need to be a part of what's about to happen with reopening. Stay home if you can. If you're not medically vulnerable, or if your financial vulnerability trumps your health concerns, you need to proceed in ways that continue to protect yourself and the elderly and medically vulnerable around you. All of us need to calm down. Quit telling people who are financially struggling that they don't care about human lives. Quit telling people who are truly at risk of dying from this virus that they are cowering in fear. Remember that until you've walked in someone else's shoes, you should probably be careful in your judgments and subsequent harsh words. We don't have to choose an either-or proposition and fight. We could choose other ways to be. Examples include, but are not limited to, I think this may be too soon, so I will continue to shelter myself and pray and make masks and check on those who can't. Or, I really need to get back to work, so I will do so. But I will be careful and try to protect myself, my family, and those around me with healthy strategies. See how those positions allow each of us to do what we need to do and also respect those who are choosing differently? One thing that allows us to do this is humility. I can acknowledge that I am not an epidemiologist, economist, whatever, that I am making decisions based on my understanding of the complex subjects and my own personal health and financial situation, that I am not all-knowing, always right, or an expert in all fields, and that each person around me is doing their best as well. We can make different choices and still be a supportive community. We can learn and evolve in our understanding of these issues. End quote. And when I saw that, I was like, wow. With all of the doo-doo that has been flying around on social media, nationally, statewide, and locally, to see something like this was a breath of very fresh air. I don't know who that person is, but awesome. How's our time? We can get some more of this in. I got an email from Molly Mulvaney yesterday about an opportunity, particularly an excellent opportunity for folks who have been concerned about what people coming through the airport, the impact that that's going to have on Cordova with fishing season starting. Here's an excellent place to focus that energy. Molly wrote me and said, I'm one of the volunteers who on April 6 began greeting passengers at the airport, providing information regarding the state and city quarantine mandates, and giving away masks. That effort has since been incorporated into the city's incident command system. We're now part of the incident management team under the operations section as the Airport Strike Team. I sometimes call it the Pandemic Welcome Wagon. Aaron Muma is the operations chief. Earlier this week, Dan Logan became the Port Authority Task Force leader, which is also in the operations section. The PATF oversees the airport, harbor, and ferry. Siwan Gelbach is the airport strike team leader. I am in charge of volunteer recruitment and scheduling. And we are looking for volunteers The duty is pretty straightforward. 2 or more people meet each plane. We welcome people to the town as they exit the airport doors and inform them of the state quarantine and city quarantine. We provide the mandatory state declaration form for them if they want to fill it out. We have helpful flyers for them to take with them with information such as phone numbers for local businesses, mutual aid agreements, etc. The information we provide continues to grow as the city makes it available. We have some of it in English, Spanish, and Tagalog. We give away cloth masks made by local volunteers. We provide volunteers with an N95 mask, and the fire department has loaned us high-visibility vests to wear while on duty. A new volunteer is always paired with an experienced volunteer. We have written safety protocols and duty protocols that is reviewed by each volunteer. A formalized airport operations document is in the works and includes the protocols as well as the objectives of the airport strike team. Each evening, C1 sends a report covering how many passengers arrived and whether additional supplies are needed to Aaron and Dan. For health and safety reasons, volunteers are folks who are 65 or younger and who are not immunocompromised. It's a 1 to 2 hour time commitment per duty slot, and people can volunteer for as many slots as they want. With the increase in traffic recently, we're starting to schedule 3 and maybe more people on duty at a time. Prior to that, 2 people had been sufficient. People that are interested in volunteering can contact me at 429-3219. Again, Molly's cell is 429-3219. So there again, if the airport has been an area of concern, if you've been losing sleep over that, a great way to do your part to mitigate risk from that would be to volunteer with these folks. And you'll be doing some real good, serious protective effort. Still a little time left? Yeah, let's do this too. Because we've heard considerable enthusiasm for what do our doctors have to say about how Cordova is progressing through this unprecedented situation. The weekly medical provider update regarding COVID-19. And this is signed by Dr. Sanders, Dr. Rush, Nurse Henniker, if I'm saying that right, Dr. Blackadar, and 3 other doctors whose names I probably would pronounce wrongly. But anyway, it's like everybody. And what they're saying is we continue the joint preparation between CCMC, Alanka Clinic, and the city. We've obtained substantial testing ability for symptomatic people in our community, currently have just over 900 kits. We continue to follow guidelines for testing. If you have symptoms, please call your provider for testing. We monitor the CDC response and FDA approvals for screening tests for COVID-19. Once available, screening will be a very important part of our response. We've increased medical supplies and medications to manage a potential surge in patients. We are available as medical advisors to the City Emergency Operations Center and Incident Management Team and have provided suggestions for industries working in Cordova. We have an emergency staffing plan in the event we have a surge of patients. Although we have no positive tests to date, it does not mean there's no virus in town. Many people, particularly young people who don't have symptoms, can of course still pass the virus on to others. Fishing season is beginning and the influx of people to our community has started, while other parts of the country are seeing flattening of the curve and are discussing lightening restrictions. Cordova needs to remain cautious. Cordova is yet to see a COVID-19 case. During the next few weeks, it's imperative that people in Cordova continue to follow social distancing guidelines and continue to be vigilant with infection control. We are ready to identify and manage cases as they come. Please encourage those with any symptoms to reach out to their health care provider. Please continue wearing a mask in public, frequent hand washing, and maintaining social distancing when out. This means staying 6 feet from non-household contacts and not gathering into groups. This disease attacks the elderly and those with existing medical problems harder. Please assist your friends and neighbors with those issues by doing their shopping and errands for them. Compliance with these guidelines will help us all return to work. It'll also help us maintain our ability to continue working. Please continue to follow Cordova mandates and guidelines. We thank you for your support during this crisis. That's from the doctors. Looks like every doctor in existence. 1, 2, 3, 4, 5, 6 doctors and 1 FNP. That's where we're going to have to put a bow on it, I think. Had a couple other things, but they're not on fire, so we'll get to them later. Thank you for listening to Town Meeting today, brought to you by Cordova Wireless Communications, keeping those very important dollars in town, the dollars that you're spending on wireless telephone service. When you're with CWC, that has a multiplicative effect. I want to thank Robbie in advance for getting this on our YouTube channel, which you can subscribe to for free and turn on notifications for free so you always know as soon as he gets a new video up there, you'll know about it right away. Daily briefings will be coming up in the 1, 5, and 8 p.m. hours. I don't know if we'll have the 5 p.m. show on KLAM this afternoon or not. That one's kind of in limbo now that the city is doing 2 briefings, so we'll just kind of see how that goes. Any program we miss doing this show will be made up, if perhaps on a delay. We wish you all the best for the weekend, and thanks again so much for listening to Town Meeting.